heard the process that we went through. We've heard the people who did the study. We've heard the actual action and somebody who actually, the face to the report. And now to hear what New York City, how New York City will relate to the seniors and to this report, we will have the Honorable Lilliam Barrios-Paoli, Commissioner of the New York City Department for the Aging.
Thank you. I'll try to be brief and not repeat so much that has been said that has been so wise. Although yesterday I was at a press conference with the Speaker of the City Council, Christine Quinn, and somebody said, I don't want to repeat myself. And she turned to them and said, what do you mean not repeat yourself? This is New York. That's all we do. So, following in that wise advice, I cannot tell you how excited and thrilled I am about the Senior Index. About 10 years ago, Merville Regan, who has been introduced before, came to talk to me. I was working at United Way and talked to me about a standard, a poverty standard, or a self-sufficiency standard for families, which of course is totally different from the poverty standard that we were dealing with. And for the first time, I really truly realized how relative poverty is, as you all know, and how a standard just by itself gives you a very general idea of what people are going through, but doesn't tell you how particular people are suffering under particular circumstances. And the self-sufficiency standard, and subsequently a calculator that was developed, was such a tremendous revolution in how we were looking at poverty and family poverty and women with young children or teenagers and so on. So the Senior Index will do that, I hope, for seniors. I don't need to tell you that poverty is really pervasive in the adult population in New York City. If we look at the federal standard, it tells us that about 18% of seniors in New York live in poverty. If you use the Center for Economic Opportunity standard, which is a standard that was alluded to before, created by the Bloomberg administration, it's 33% of seniors that live in poverty. 1/3 of all seniors in New York City live in poverty. And that measurement does not take into account the particular circumstances of people. But it does include the cost of housing, and it does include the cost of out-of-pocket health care. What exacerbates poverty in New York City is that we have a very high immigrant population, extremely so. And most immigrants, or many, many immigrants, are not eligible for Medicare or Social Security. So most of them are living in whatever meager savings they have or the charity of their children. Compounding things, many, many seniors that are immigrants came to this country following their adult children who are now established here. So many of them cannot speak English. Many of them have immense cultural barriers to adaptation in New York City. So it's not just poverty of material things, it's also emotional poverty of being taken away from everything they're familiar with and everything they really know. And I'm saying that because, when we're talking about support systems, many senior centers provide that for those seniors. We have senior centers that cater to probably every ethnicity that one can imagine, but increasingly we realize that there are many, many, many groups that need that kind of support. Not only the meal that they're provided, which in many instances is the main meal, but also all of the emotional supports. We have centers that are Hindu speaking. We have centers that are many different dialects of in the Chinese language speakers, many Korean senior centers. We have senior centers that deal with the Polish population and the, and Irish, just because people need those kinds of supports. Just to give you an example of what I think the index would do, the average older New Yorker that is renting a one-bedroom apartment in New York City requires an annual income of about $25,650 to meet the basic needs. In contrast, the income of 37% of New Yorkers' older households is less than $20,000. So housing creates one of the most difficult situations for the elderly in New York City. Even though we have supplements like SCREE, which is it's sadly to say only 30% of the people who are eligible to obtain scree, which is another very not well publicized benefit. A lot of people hesitate to take public benefits. They see this as something that makes them dependent, and they don't want to do, and don't realize how the numbers just don't work in their favor. And I think this index used as an instrument to work with seniors in counseling and say to them, look, this is your income, this is what you're eligible for, and wouldn't it be better if you would accept the food stamps or the scree or whatever else is available? It'll make your life so much easier. And I think that worked with families very, very well, so I'm very hopeful that it'll be the same thing. I am also very hopeful that this will help us in doing planning. I actually found out about the index the first time. I reached out to Merble, who has been sort of my guru on all things related to income and stability of income, because we were trying to move, we had to cut back. We had to make a big cut in home care that is not Medicaid directed, but home care that is funded by ISIPS and by the city. And ISIPS is a funding stream from the state. And one of the things that came up that the staff flagged for me was that many seniors were not Medicaid eligible, but could receive the home care, but couldn't meet the surplus, that the payment towards the care. And we had no objective way of telling whether this was true or not. And there was a big thing going on between my staff and the provider community as to what was the acceptable level of expenditures. And I said to them, look, we need an objective way of measuring this. It can't be like, everybody decides on their own what is feasible or not. And so because of the experience I had with this self-sufficiency indicator, I said to Merble, don't we have something for seniors? And she said, it so happens that we've been working on this. To me, this is something incredibly useful, because now when we're saying to an elderly person, yes, you can pay towards your care, we'll have an objective base to say that. And guess what? The numbers that I'm looking now, I don't think a lot of them will be able to pay towards their care. And that's incredibly useful information, because we don't want to further impoverish people, which is sometimes what you do, with some programs that you think are wonderful, but if there's a contribution, you're just further exacerbating their situation.